This is the part of the show where we give you an idea of stories worth tracking but aren't necessarily on your front pages. The South African Society of Psychiatrists has warned that the COVID-19 pandemic has impacted hugely on South Africa's mental health system. There's a shortage of beds at psychiatric facilities. Many patients have not been collecting their medication, and there are an alarming increases in the number of relapses. And as hospital beds become scarce, health authorities are actually borrowing beds from psychiatric wards, as well as some of the hospitals, as well as a mix-up is happening with COVID-19 positive cases, as well as other mental health patients. Certainly is a cause for concern. The Society of Psychiatrists say this is both ill-informed and dangerous. To speak to us about how mental health care systems are being impacted, I'm now joined by Professor Bonga, Chiliza, who is the president of the South African Society of Psychiatrists. Bonga joins us via Skype from Durban. Prof, thanks very much for your time and welcome to the AM Report. Perhaps as a start, we can begin by painting a picture. How far from the brink, really, has the mental health system been pushed since the beginning of the COVID-19 pandemic?
Yeah, good morning, Ayanda, and good morning to the viewers. I think just maybe to take you a little bit one step back, I think you may be aware from the Life is Demeni tragedy that was reported in Gauteng that the mental health care system has actually been under strain for many, many years. The reports that human rights have commissioned have kind of showed that there's a number of infrastructural issues that is an infrastructure backlog. There's a number of issues that we are struggling with. So I think the pandemic has actually hit us when we are already under significant strain, and this is why there's this sort of twin peaks, if you like, of a collision between the pandemic and what is needed to address it and what is already happening in our mental health care system.
And I guess, part of the concerns is that it also comes at a time where resources in the entire healthcare sector were already stretched. I do wonder whether we've arrived yet at a place where we need to, dare I say, prioritize some of those resources to deal with more urgent problems. I mean, in what ways is that affecting mental health in the country?
Yeah, so obviously I think a lot of us are have been spending a lot of time planning about what will happen when the COVID pandemic really hits our hospitals, and where that is now the reality is in the Cape, in the Western Cape, and what we are finding is that clearly the way that the wards the psychiatric wards in our general hospitals are designed are not ideal for dealing with this pandemic. So just to give you a little bit of an idea, so most of our psychiatric patients are admitted into psychiatric wards in general hospitals, and these are usually about 20 bedded wards, sort of for 10 females and 10 men, and with very few sort of seclusion rooms or single rooms to deal with. And so in this space, you have to now cater for people that do not have COVID, for people that perhaps may have COVID, or what the doctors call PUIs, people under investigation, and also for people that are COVID positive. And it's really difficult to try and do that within the infrastructural sort of bounds of our current existing wards. So our society are saying that in the Cape, for example, it's very clear that it's not going to be possible to be able to do this. And so our society is calling for measures, for example, like declaring some hospitals entirely COVID for COVID patients, and then other places perhaps for non-COVID patients, maybe in each of the different cities. That's kind of what we should be doing. And we have also other measures that we've outlined. So, for example, using the private sector, getting them involved, getting the NGO sector involved, to try and really increase the capacity for beds, because at the current moment we're really not coping with what's happening, particularly in the Western Cape and the Eastern Cape.
Yeah, and of course we all know that the Western Cape is the epicenter of the COVID-19 pandemic, so in some respects one would imagine that there's a particular amount of strain there as well. Give us an idea, I guess, of the level of engagement that have taken place with government, though. I mean, do you get a sense that as society generally starts to speak more openly about mental health and its effects, that government too is coming to the party by being more, I guess, deliberate in their attempts to try and assist the sector?
Yeah, so unfortunately, it kind of varies according to the provinces. But so, for example, there are some provinces like in Gauteng that have got a very good collaboration between the psychiatrists that work for the Department of Health and the seniors in the Department of Health. I think there are also other provinces like in KZN where there's a mental health directorate that is really well supported, I think, by psychiatrists. But in other provinces, not so much. So some provinces do not even have a mental health directorate, people that deal specifically with issues of mental health. And we have been calling for strengthening of the governance of mental health for a while in the different parts of the country. And so, yeah, there are some positives, but I think there's many provinces that are still lacking in trying to help develop and strengthen the services for mental health care users.
And the UN also releasing a report at the beginning stages of the COVID-19 pandemic stating that, in fact, because of the ways through which COVID is even affecting our lives, there's an increased risk that it might spark mental health issues for many more South Africans, including those that are COVID positive. Would you say that South Africa is currently dealing with a mental health pandemic too? I mean, are we at that stage yet, do you think?
So I would say that my colleagues have, in private practice and other colleagues in the government who are dealing with this are kind of saying that the mental health pandemic is probably going to follow on the COVID pandemic. So what happened actually, it's quite interesting, is that in the first month or so of the lockdown, very few psychiatric patients were accessing services. So it was actually quiet and the wards were quiet. And as the time went on, our current psychiatric services, users of our psychiatric services started kind of relapsing, and because of the additional stress and anxiety, and so they started filling up our wards, and so it became quite busy. So at the moment we are seeing our patients with psychiatric illnesses relapsing and coming in to see us because they were scared of coming in to get care. But we think that the secondary sort of pandemic, where other people who did not have mental illness before the pandemic are probably only going to start coming into our wards a little bit later. In the US, for example, we see that young people with a suicide who present to hospitals following a suicide attempt and all that have now also spiked. So we're also expecting that there would be some increased risks of suicidal behavior and anxiety amongst the general public after this after the pandemic has kind of hit us a little bit more after the peak.
All right, this is certainly an important issue. Hopefully it'll continue gaining the attention it needs, but we're going to have to leave it there at least for now. Certainly appreciate your time. Professor Bonga Chiliza is the head of the South African Society of Psychiatrists.